Good evening, viewers. A warm greeting from Faculty of Health Sciences, MAHSA University. I am Nelson Arpudra John. I am the moderator for today's session. I would like to thank you all for being here with us through this live session from MAHSA University. Today we have a webinar among the series of webinars which we have been organizing and conducting from the Faculty of Health Sciences. Today's webinar is on exercise and women's health, effects of high intensity exercise. We have amongst us two prominent speakers to share their expert knowledge among us. So before I take you through this webinar, I want to take you through a short tour of the programs offered in our faculty. MAHSA University has been a pioneer in the field of education, and we in the Faculty of Health Sciences are offering programs in physiotherapy, environmental health, and medical imaging. In the Faculty of Health Sciences, we have the School of Physiotherapy, Department of Environmental Health and Medical Imaging. Why do we have to join a health science and be a healthcare professional? We know that healthcare has been in demand through decades, and it is having a high job demand because it is one of the essential and emergency services which we offer. It is also providing us an opportunity to work in various settings, a career which you can be feeling good of, with no boring work routine and a low risk of job automation. MAHSA University, an excellent, infinite perfection is what MAHSA aspires to provide to each of its own graduates. We from the Faculty of Health Sciences, we are offering various programs with diploma, degree and masters. From the School of Physiotherapy, we have diploma in physiotherapy, Bachelor of Physiotherapy honors degree, which is also run as an ODL program, and we also have Masters of Physiotherapy. From the Department of Environmental Health, we have Diploma in Occupational Safety and Health, Diploma in Environmental Health, and Bachelor of Environmental Health and Safety, so honors degree. From the Department of Medical Imaging, we have Diploma in Medical Imaging, Bachelor of Medical Imaging honors. Master of Physiotherapy, we run as a full-time program and also as a part-time program. The full-time program runs for a period of 1 year, and a part-time program runs for a period of 2 years. The entry requirements, as you can see, is a bachelor's degree level 6 MQF or equivalent with minimum CGP of 2.50 in related fields as accepted by SNET, or a bachelor's degree level 6 or equivalent not meeting CGP of 2.50 but can be accepted subject to a minimum of 5 years working experience in the related field. So we also have English proficiency as a requirement for the students, mainly for the international students. The Bachelor of Physiotherapy program is run as a 4-year program for the direct entry students and also as a 3-year program for the diploma entry students. For Bachelor of Physiotherapy, we have an entry requirement of pass in matriculation or pre-university or STPM program or equivalent with qualification with minimum GPA of 2.33 in 2 of the following subjects, namely biology, physics, mathematics and chemistry, or an A-level pass or equivalent with minimum grade in 2 of the following subjects, biology, physics, mathematics and chemistry. Or they can be a pass in diploma with level 4 MQF with minimum CGPA of 2.75, or a pass in diploma level 4 MQF with CGPA less than 2.5 but having a minimum of 3 years of working experience in the related field. Or they may also have another recognized qualification as accepted by SNET. We also have English proficiency as our entry requirement. Diploma in Physiotherapy is run as a 3-year program. The entry requirement for which is an SPM or equivalent with pass in Bahasa Melayu and English, and 5 credits in the following subjects, namely mathematics, 1 science subject, and any 3 subjects including Bahasa Malaysia and or English 8 credits. Or the students can have a pass in GC O level or equivalent with pass in Bahasa Melayu or English, or grade C in following subjects, namely mathematics, 1 science subject, and any other 3 subjects including Bahasa Melayu or English. They may also have a certificate which is level 3 in MQF in the field of health science with minimum CGPA of 2.75. They may also have other recognized qualification of equivalence which subjected to the approval of the Senate. The Bachelor of Physiotherapy program is also run as an open and distance learning program, we call it as an ODL program, which is also running as a 4-year program for the direct entry students and as a 3-year program for the diploma entry students. The entry requirement is the same as the bachelor's regular program. The details about these entry requirements, you can find it in our MAHSA website. We also have bachelor's program in environmental health and safety, which is run as a 4-year program for the direct entry students and also as a 2.5-year program for the diploma entry students. The entry requirement is a pass in matriculation for pre-university or STPM or equivalent with minimum GPA of 2.33 in 2 of the following subjects, namely biology, physics, mathematics, and chemistry. Physics or mathematics and chemistry. They may also have a pass in A level or equivalent with minimum grade in 2 of the following subjects, namely biology, physics or mathematics, and chemistry. A pass in diploma is accepted at the level of MQF 4, with level 4 MQF with minimum CGP of 2.75 in a related field, or they may have a minimum of 3 years working experience if the CGP is less than 2.75. And English proficiency is taken as an entry requirement. Environmental Health Department also provides a diploma program for 3 years. The entry requirement is same as diploma entry requirement for the other courses. The details of this you may find it in the MAHSA website. Bachelor of Environmental Health and Safety. It is also run as an open and distance learning to cater to the needs of the students who cannot join the regular program. It is run as a 4-year program and also as a 2.5-year program for the diploma entry students. The entry requirement is a pass in the matriculation of pre-university, STPM or equivalent with minimum GP of 2.33 in 2 of the following subjects, namely biology, physics or mathematics, and chemistry. Or could be a pass in A level or equivalent with minimum grade in 2 of the following subjects, namely biology, physics, mathematics, chemistry. So they may also have a pass in diploma level 4 MQF with minimum CGP of 2.75 in related field, or if the CGP is less than 2.75, a minimum of 3 years working experience can be accepted as the entry requirement. They may also have any other qualification of equivalence subjected to the approval of Senate. And the English proficiency is taken as an entry requirement for both local and international students. Bachelor of Medical Imaging Honors also run as a 4-year program for the direct entry students and as a 3-year program for the diploma entry students. This is the entry requirement. The Medical Imaging Department also provides a diploma program which is run as a 3-year program. The entry requirement is as like the diploma entry we have seen for the other courses. We also have another program which is Diploma in Occupational Health and Safety, which is run as a 3-year program. The entry requirement, it could be a pass at the level of SPM or O level, or it could be any certificate related to health science with a minimum CGP of 2.50. So all the entry requirements, if you need to know in detail, you can find it in the MAHSA website. You can put in your queries in the MAHSA website and a public relations officer would be happy to contact you. Right, regarding the experience in MAHSA, we have an experienced and dedicated academic staff providing to the needs of the students. both academically, professionally, and clinically. And we have various study modes, both in the conventional mode and also in the open and distance learning. We have cross-teaching by experts. We have collaboration with various universities. We have an interactive teaching program, both as a face-to-face model and also through an online platform where we interact with the students. We have an exhaustive list of hospital and institutions for clinical and industrial placement of the students to enhance their clinical skills. And all the courses are accredited by MQA and JPA with international recognition. MAHSA also provides scholarships for those students who need to pursue their education but having some difficulty, because MAHSA has been a pioneer in the field of education, and providing education has been the basic agenda. And we have various scholarships like Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teacher Scholarship, Family Scholarship, and the Single Parent Scholarship. If you need to know about how to apply for these scholarships and your eligibility, please you can contact a public relations officer through the MAHSA website. And we have an additional programs like the PRIDE, which is Professional Industry Driven Education, where we train the students in extra skills which are needed for their professional advancement, which provides a boosting for their academic performance, where they can be globally accepted through proper certification, and which can also enhance their employability. We have associations with various universities across the globe, where we have the student mobility programs, where we send students and receive, so that we can collaborate with other universities for clinical, professional, and research activities. Okay, so we have some, yes, excuse me for a minute. So we have the student mobility program in from collaborating with universities in
Good evening, good afternoon. My name's Steve Milanese. I'm Associate Professor from the University of South Australia, and I'm going to talk about exercise and women's health, particularly related to high intensity exercise. So if I just share the screen. Okay, so we're going to cover looking at the effects of high intensity exercise in exercise and women's health. So, as I said, I'm from the University of South Australia. I'm the Program Director of the Masters of Advanced Clinical Physiotherapy and the Director of the International Centre for Allied Health Evidence. So the first question has to be, what is high intensity exercise? We basically break down physical activity or exercise in 3 intensities. We have low intensity activity, which is about 40 to 50% of your maximum heart rate. So the best way to look at your maximum heart rate is to feel your pulse near your wrist on your thumb side, take from there, and the maximum is generally about 220 minus your age, and that's what we aim for as being the maximum, as a rough idea. So take your heart rate, if you're 40 to 50% of that maximal heart rate, 220 minus age, then you're working in your low intensity range. And this will include a casual walk, stretching session, yoga, tai chi, and generally I like to use the talk test, which is when you're doing the exercise, it's easy to keep the conversation going. You can talk to your friends while you're doing it. Moderate intensity activity is working up to about a 50 to 70% of maximal heart rate. It could be weight training, endurance exercises, so lower level, the heart rate's increased, but nowhere higher than low intensity. You can do the talk test. You can comfortably chat, but you wouldn't be able to sing. So if you tried to sing, a few more words, where you're putting a bit more effort into your conversation, that you would find you'd run out of breath fairly quickly. So that gives you an idea you're working in the moderate intensity range. We're more interested tonight, or this afternoon, in the high intensity activity. This is where you're working at 70 to 85% of your maximum heart rate. And that could be circuit training, vigorous weight training, any of the moderate intensity exercises at a faster pace. And again, the talk test, which I always think is the best way of judging, is that you can't really say more than a few words without having to pause to breathe. And when we talk about high intensity exercise, the reason we're talking about tonight, I think, is because it's very popular. It's becoming more and more popular, particularly in the form of high intensity interval training, so HIIT training. It's a form of interval training where you do brief, high intensity anaerobic exercise. So you're not doing it long enough to build up to use aerobic energy systems. You're working at about 85 to 100% of your VO2 max, your energy level, and different people talk about from 6 seconds up to 4 minutes. And then you do a spurt of intense anaerobic activity, and then you have a break where you do a longer bout of low intensity aerobic type activity with a range of about 20 to 40% VO2 max of your energy level. So it becomes a light intensity, a low intensity. And you do that for up to 5 minutes, usually longer than the high intensity. And that's what we call high intensity interval training, that's talked about a lot in the media. The big advantage of high intensity training, and the reason it's so popular, is that you appear to get your health benefits with less time exercising. So you got to put more effort in, but it's over faster. And Niven et al. Did a really nice study in 2020, where they reviewed 33 studies. They did a systematic review looking at high intensity exercise versus moderate intensity exercise. And within the high intensity exercise, he looked at particularly high intensity interval training, so HIIT training. And it was a really interesting study, I think anyway, because when all the research they found, and they were interviewing people who were doing these sort of exercises, they found that most of the people doing the high intensity interval training reported it as being less pleasant when doing it than moderate exercise. But when you talk to people overall who are doing HIIT training, they said it was more enjoyable. So it seems to be less fun while you're doing it, but I think because you have to do less of it, you kind of enjoy it more. The reason we differentiate the different levels is because when we look at the WHO and the American College of Sports Medicine's recommendations for healthy adults, and these are in Australia as well, we have them, that this is our government recommendations on levels of physical activity. So they recommend that to maintain or improve your health, you need at least 150 minutes of moderate intensity exercise a week, or 75 minutes of vigorous intensity exercise per week. So either. So that's our recommendation. So it's important to understand the difference between the two. And I think, like I said, more people are going for the high intensity because they can do it quicker and get it out of the way, because we all live busy lives. So what is the effect of high intensity exercise? Patacan, another systematic review, reviewed 65 studies exploring the effect of high-intensity interval training on the cardiometabolic health compared to moderate intensity exercise. And they divided it into short-term, so less than 12 weeks, and long-term, greater than 12 weeks, participation in these high-intensity interval training programs compared to moderate intensity exercise. They found that with the short and long-term, or particularly the long-term high-intensity interval training, significant improvement in waist circumference, percentage body fat, VO2 max, so fitness level, your resting heart rate, systolic and diastolic blood pressure, but only in overweight obese populations. And what they found when you look at it in normal weight populations, that really high intensity training improved the fitness from a VO2 perspective, so our physiological fitness, but didn't really change our weight, didn't change heart rate, didn't change blood pressure in normal weight people. So the biggest effect appears to be on overweight or obese people. Adults, focus with them. Wellage in 2017 looked at 13 studies, particularly exploring the effect of high intensity exercise compared to moderate intensity exercise in overweight and obese individuals. They found that both of them actually elicited significant reductions, but there really wasn't much difference between the two. So really, whether you do high intensity training or moderate intensity exercise, the key is to be doing exercise for weight loss. But the high intensity training took 40% less time commitment. And again, in the real world, we're all very busy. And so we need to think about how we can fit exercise into our busy daily lives. So high intensity training seems to have benefits from that side. A finding I found really interesting from this result was that actually running had larger effects on whole body fat mass, but cycling didn't. So independent of whether you did high intensity or moderate intensity, running seems to have a better effect on weight loss than cycling does. I found it interesting probably because I'm a cyclist, not a runner. But fertility, so particularly now looking at the effect on female issues specifically, Hakimi and Cameron in 2017 did a systematic review of 14 studies exploring the effect of exercise on ovulation. And this is mainly because about 30% of fertility issues are related to anovulation, so limited or no ovulation. So what they found was that extremely heavy exercises, those who do high intensity training for greater than 60 minutes a day, had an increased risk of limited ovulation, so reduced fertility. But vigorous exercise, so high intensity exercise of up to 60 minutes a day, was associated with reduced risk of infertility related to an ovulation. So, and what they found again, the difference seems to be, the effect seems to be different in larger population than smaller. So in the overweight females, that in fact exercise, high intensity or otherwise, particularly high intensity in this one, even without the diet, with or without a supplementary diet, both led to resumption of ovulation. So it seems to have a positive effect in overweight and normal weight subjects up to about 60 minutes a day. And after that, it appears to have a decreasing effect on fertility. When we look at pregnancy, this is often an issue with high intensity exercise in women. People are always arguing, should I be doing high intensity exercise when I'm pregnant? Beetham et al. Looked at 15 studies exploring the effect of high intensity exercise on pregnancy, and particularly related to the third trimester. And what they found is that high intensity exercise in the third trimester actually seems to be safe for most healthy pregnancies. So when you're talking about a normal, healthy pregnancy, high intensity exercise, even in the third trimester, appears to be safe for the woman and the child. And I think what they're finding was interesting, that it seems to be safe, particularly if this is your preferred method of exercise. So it's not recommended if you've never done high intensity exercise before, you get pregnant, and then in the third semester, wake up one day and decide to do high intensity exercise. So it should be something that you've done prior to the pregnancy, you're used to high intensity exercise, your body is used to it. Then all the indicators from the last 30 years of research has been that actually high intensity exercise during pregnancy is not a bad thing. It's actually positive. One of the issues that is often talked about with high intensity exercise is the menstrual irregularities. And so disorders of menstrual function are recognised to occur more frequently in female athletes than in the general population. And the changes we've talked about really relate to the effect of exercise on the hypothalamus. And so the overtraining, if you like, so the increased training affects the hypothalamus, particularly related to stress. This results in a decrease in estrogen level and therefore leads to menstrual irregularities. And there seems to be two major influences on the changes in the hypothalamus. One is the critical level of body fat, and the second is the effect of stress. And high intensity exercise, if you're not used to it, can potentially be a stressful event which will affect the hypothalamic reaction. Delayed menarche, there's been a positive correlation between delayed menarche and high performance athletes, but interestingly, in particularly sports such as gymnastics and ballet, where we see a lot of delayed menarche, in fact, most of the research shows it's less related to the exercise or the load of the female athlete and more to their body weight. So there seems to be a higher relationship between menstrual irregularities and body weight rather than exercise. When we talk about athletic amenorrhea, so for dysfunction in the cycle, again, it's a lot higher in the athletic population. Very common in ballet, long distance running, rowers, triathletes, so endurance type events rather than the high intensity. So it seems to be less related to the high intensity exercise as much as the prolonged exercise when you look at the sports it's actually involved in. Causes for menstrual irregularities, sporting amenorrhea include inadequate diets, low body fat, exercise and the luteal phase defects. There's some effect of the exercise on the short and luteal phase of the menstrual cycle, and obviously psychological stress. And those stresses are what affect the hypothalamus and lead to estrogen changes. And what we talk about with exercise-induced menstrual disturbance is this notion of the female athletic triad. So this is related to disordered eating, and this is not an eating disorder. So when you talk about disordered eating, we're not talking about anorexia and bulimia, psychological disorders. We're talking about just restrictive diets. So it's not a psychiatric problem, and when you talk to athletes, they often really control what they eat based on their load and based on their training, etc. And this is disordered eating. And when they finish their careers, they go back to eat normally. There's menstrual irregularities that we've talked about related to the athletic triad, and the risk leading to osteoporosis. And that's one of the biggest issues associated with menstrual irregularities is the risk of osteoporosis. So the management really involves dealing with the cause of the problem. So rather than worrying about the exercise in this area, it's really about the diet and the eating disorders. So it's body weight that usually has the biggest issue in amenorrhea, so the biggest influence on it, so making sure they maintain a healthy weight frame and they eat appropriately. And this also helps to deal with the complications such as stress fractures, which relate to the osteoporosis or osteoporotic changes and the physiological changes in bone. And also with the menstrual irregularities, like I said, one of the key factors the evidence is showing is actually it's the weight. The increased body weight affects the chemicals in the body, which affects the hypothalamus, and it causes increase in estrogen and can lead to a return to normal menstruation. So in conclusion, high intensity exercise has benefits to the female athlete. Absolutely, it's not a bad thing at all. High intensity interval training seems to save time, but really it appears to have little extra benefit apart from the saving time. And really the key for me when you look at exercise, and this goes across any athlete, any subject group, participant group, community group, is that exercise should be enjoyable. Some people are short on time. When they balance their life, they don't like exercising, in which case they should do high intensity interval training. If you don't mind your exercise, you quite like the exercise, then you'll get just as much benefit from moderate exercise and probably a bit safer from a joint perspective. So thank you for
Thank you, Dr. Steve, for the insightful presentation and sharing your expert knowledge.
Dr. Steve is an associate professor from the University of South Australia. Dr. Steve Milanes is the director of International Center for Allied Health Evidence, Sansom Institute, and the program director of Masters of Advanced Clinical Physiotherapy program from the University of South Australia. He holds a postgraduate qualification in ergonomics, manual therapy, and sports physiotherapy. Dear viewers, before we proceed on to the next part of the webinar, we apologize for the temporary technical difficulty we have faced. Going on to the next part of the webinar, I take extreme pleasure in introducing our next speaker for the session, Ms. Sonia Dua Diwan. Ms. Sonia is a lecturer from the School of Physiotherapy, MAHSA University. Ms. Sonia holds a master's degree in physiotherapy and postgraduate qualification in pain management from Scotland. She has more than 15 years of academic and clinical experience in the field of physiotherapy. Her research interests are in the area of chronic pain, education, pelvic pain, and incontinence and women's health. With extreme pleasure, I hand over the session to Madam Sonia.
Yeah. Okay. I go back again. Yeah. Okay. All right. I'm sorry. There was some problem there. All right. So what I'm going to talk about is the effects of high intensity exercise on pelvic floor dysfunction. So we're going to take up a little bit of anatomy. So when we look at the pelvic floor of a female, we look at the perineum, muscles, fascia, connective tissue, along with the aponeurosis. And female perineum is basically made up of superficial muscles. We're going to have your superficial transverse perineal muscles, pulvocavernous muscles, and your ischio-cavernous muscles. The pelvic floor also is, or perineum is also made up of perineal membrane layer, which is basically is the sphincter control, where you have all the sphincter muscles associated and the compressor urethra associated with it. And this is also called your urogenital diaphragm. Then you have the anal triangle. Anal triangle basically is made up of your internal sphincter and external sphincter muscles. And these muscles are the one which actually, especially the internal sphincter muscle, is the one which actually goes for tear at the time of vaginal delivery. And then you have the perineal body. Perineal body is nothing, it's just a fibromuscular junction between the your urogenital diaphragm and your anus. Why this is important is because when the episiotomy happens, or when the tear happens during the vaginal birth, that is the area which goes for the damage or the trauma. So when we talk about the pelvic diaphragm, we are talking about the levator ani muscles, which is very important to maintain and support the pelvic organs, and which also resist in your intra-abdominal pressure, which has a sphincter control in terms of your micturition and defecation, and which also provides stability into the pelvic spinal stability. And these muscles are your pubococcygeus, pubovaginalis, puborectalis, and iliococcygean. Along with that, you will have the coccygeus muscle as well, which will be helping and supporting and making as a whole floor of the pelvis and supporting the organs. You also have obturator internus and piriformis muscle, which is completing the whole floor, which is filling the gaps there. These are lateral rotator of the hips, or rotator of the hip joint. And if any kind of trigger point or any hypertonicity in these muscles, which can lead to your vaginal, rectal, or clitoral pain. You also have piriformis muscle closing the floor again, and this is, you know, that there's a sciatic nerve passing through the piriformis, and the compression of sciatic nerve can happen, and that leads to pain in the buttocks and pain in the thigh, and mimics the other dysfunctions as well. So what is this pelvic muscles? Are the fibers which are made up of. Basically, you're going to have two types of fibers. So mainly the 70% is a slow twitch fibers, because it has to maintain the tone. It works as a trampoline, like it works as a support to support the pelvic organ. So mainly it's the slow twitch fiber, but you have the 30% fast twitch fibers, which responds quickly to resist the intra-abdominal pressure and also maintain the sphincter closure as well, or sphincter control as well. So if you see that the muscle fiber gets recruited in different sports, depending on what sports, what high intensity sports you are doing basically. So if you're doing in the, say for example, in long distance running, your type 1 fibers are getting recruited, as compared to 400 and 800 meter running, you're going for fast twitch fibers. And if you're going for sprinting, because you need explosive action, so then you end up having the type 2 fibers there. So anytime, because the high intensity exercise which is an impactful exercise, so normally what has been found is the three common dysfunction which happens is the urinary incontinence, anal incontinence, and pelvic organ prolapse. So this hammock analogy actually works to explain how the pelvic floor muscles are supporting these organs. And these are the ones which is actually making the floor of the, and closing the inlet and outlet, sorry, and then it is controlling, I mean, it is supporting the bladder, it's supporting the uterus and rectum. And your endopelvic fascia, or the fascias and aponeurosis, basically works as a rope which is controlling these muscles there. If you have too much mobility of these muscles, you're going to end up having the risk of prolapse or incontinence. And if there is too much of hypertonicity in this muscle, then you're going to end up having a severe pain like a pelvic pain or vaginismus. The risk factors for pelvic floor is basically age. So if you are, your age is an important factor. I mean, the middle-aged women and menopausal women basically are at the risk. They are the more prominent to get the pelvic floor dysfunctions. You have the parity. So if it's nulliparous, you have less risk as compared to multiparous women. Vaginal delivery is always a risk for pelvic floor dysfunction at a later life. Constant straining, if you have been straining for a very long time, or if you have constipation issues, then that also leads to your damage to your pelvic floor, and then leads to your dysfunction, especially your pelvic organ prolapse, which happens in the later life. Amenorrhea, or if you're taking a hormonal therapy, if you're not having menstrual is not happening there, or absence of menstruation also has an impact on that. And the duration and intensity of exercise, which is still a question mark, whether how much the intensity and how much duration of exercise should be there to avoid the pelvic floor dysfunction. It seems that the duration and intensity of exercise have been associated with pelvic floor dysfunctions. So when we talk about the benefits of pelvic floor, benefits of physical activity, we are talking about weight control, maintaining the cardiovascular endurance, controlling our systemic problem like diabetes, maintaining the muscle mass, preventing osteoporosis. So when we define this physical activity, or when we define high impact and high intensity exercise, we're talking about exercises which require several jumps and actions related to maximum abdominal contraction. And optimum functioning of PFM will happen if it's counteracting the intra-abdominal pressure, and it is able to absorb ground reaction forces when you're performing a high intensity exercise. But what has been found is that if you pre and the co-contraction of PFM is always delayed, especially in jumping or any landing activities, like if you're going for gymnastics, if you're going for ballet and cheerleading groups. Okay, so this PFM contraction actually gets delayed, and that leads to your incontinence problem. So there are few hypotheses actually existing and has been highlighted by research, whether we should do the strenuous exercise and we should not do the strenuous exercise. What is the point of view? So basically, one belief is that if you do the sports training, it actually strengthens your pelvic floor and works as a protective mechanism for your pelvic floor dysfunctions, because you're going to have a tonic increased tone, and that increased tone will actually lift the pelvic floor and will reduce the risk of pelvic organ prolapse or a fecal incontinence as well. But there are many studies which have found that there is no difference between the pelvic floor muscle strength between the athletes or the women who engages in high intensity exercises and the low intensity exercises. So what does it mean? It means that the sports training alone is not sufficient to improve pelvic floor muscle strength. We need to incorporate the pelvic floor training along with the sports to actually so that the co-contraction can happen with the trunk muscles and the pelvic floor muscles for the optimum effect there. The other school of thought is that the sports training actually weakens the pelvic floor muscle and has a negative impact due to the changes in biomechanical and morphological factors, which leads to your fatigue theory. So basically, there are a lot of changes which are going to happen at the neuromuscular level. The changes are happening at the anatomical level and metabolic level. So those things leads to your weakening the PFM and then making the risk of prolapse of PFT basically. So overloading and repetitive stretching of PFM damages the integrity of perineum, because you are having the repetitive intra-abdominal pressure is increasing, especially in the landing, especially in the runners if we see it. So runners have to just, the landing activity is more, the force, ground reaction force is more. So you're overloading the PFM muscle, which will damage the integrity of the perineum, especially your periurethral serrated muscles, and that will lead to your pelvic floor dysfunctions. So there's a new study, the Bo et al. Has actually found that, and they have actually compared the athlete and non-athlete runners, and they found the larger diameter of puborectalis muscle with larger bladder neck descent and greater urogenital hiatus. And what that means is that there are changes happening in the puborectalis muscle, which is a main muscle to give the support. The other thing which we're talking about, the muscle fatigue, is basically due to the training effect, where your type 2 fibers, actually the fast twitch fibers, get recruited, and then that gets fatigued easily, because you're gonna have, they have to counteract the intra-abdominal pressure for a prolonged or recurrent times, and that descends your PFM, and that changes happen in the intrafusal fiber, and that will delay the response time. So the maintenance of tone will get affected, and the tone will not be able to maintain, and that will lead to your urinary incontinence mechanism getting compromised. So few studies have actually looked at the prevalence of high intensity exercise and pelvic floor dysfunctions, and this study done by Hai et al. Actually looked at the pelvic floor dysfunctions by symptoms in CrossFit workout trainers, and they recruited 314 females, and they collected the data from 990 gyms in US, and they found that the stress urinary incontinence and pelvic floor dysfunctions and fecal incontinence is more who participated, in females especially, who participated more in 3 CrossFit workout for 1 to 2 hours per week. And they also found that the younger females were affected with urinary incontinence than the general exercises. So basically, the stress urinary incontinence were more in the one who worked out more, as compared to younger female who were having only just the general urinary incontinence, but not really particularly going into stress urinary incontinence. And this another study who looked at, this is a systematic review, who looked at the 9 studies exploring the prevalence of urinary incontinence among female across the high impact sports activities. So they looked at different sports, and they found out that whether the prevalence of incontinence varies according to sports, and the result shows that the prevalence of urinary incontinence in female was 25.9%, and especially the stress incontinence was 20.7%. And the most prevalence which was found was the volleyball, which is a high impact exercise, and trampoline, as compared to just a distance runner. So they found that is a very strong relationship there between the sports and the pelvic floor dysfunction, especially the stress urinary incontinence. Okay. There are other study which found that in the runners, basically, so they the women who participate in high intensity exercise, sometimes the recreational running also has a higher risk of POP and anal symptoms, basically, than the CrossFitters, which is a combination of high intensity exercise and strength training. They found that the AI is actually highly correlated with distance running due to the repetitive impact mechanism of running and ischemic effects of gastrointestinal tract, which is normally found in Paris women, but they couldn't find the same finding in a nulliparous woman. So stress urinary incontinence is seen both in runners and CrossFitters, especially in vaginal Paris women, because we have the vaginal delivery is one of the risk factor for the PFT, basically. So that is what they have found at that. And there's another study which looked at the relation between the stress urinary incontinence and in the rope skipping in adolescents, and they found that 75% adolescent girls actually leaked and 7% boys actually leaked while skipping, which they were not even aware of. So, I mean, there's a lot of, in terms of what this data basically suggests, that there is a very strong relationship that the pelvic floor dysfunction does happen with the high intensity exercise and high impact sports activity. And in terms of management, you have to go for a pelvic floor training. Yes, that is important. But we also, the data is also, a lot of people are also suggesting that pelvic floor synergist training is also required, not just only pelvic floor muscle training would be enough. So what is this synergist training is basically, because we have talked about that how the pelvic floor actually works with the trunk stabilizer, so we need to work together. So it has to be a co-contraction of pelvic floor muscle and the trunk stabilizer muscles to improve the urinary symptoms. And there was a recent study which is under the publication now at this point, this is just January 2020, has looked at, they have done the RCT and evaluated the effect of PFM training with transverse abdominis activation in nulliparous women. And they actually added the posture, whether it's better in supine or the symptoms are prone in sitting. And in control, they compared with the control group. And they found that there was an increased thickness of transverse abdominis muscle, and symptoms actually disappeared in the sitting position and supine posture rather than standing in any other position. So what does this say? That you should be able to, when you're going for pelvic floor muscle training, you should also be incorporating your transverse abdominal muscle training, or the core muscle basically needs to be incorporated, and sitting supine, and then you go for a functional training for the symptoms to disappear. The other thing which they talk about is the breathing exercise, exploratory exercises, which is really important, which has seen an association, has been seen, because diaphragmatic breathing has shown and has been associated with PFM function as well. And these breathing exploratory exercises are used in yoga, Pilates, and hypopressive techniques. Hypopressive techniques are nothing, it's just that you need to, once you empty your lungs, then you need to just co-contract your pelvic floor and abdominal muscles together, and then just hold it for a second, and then few seconds, and then you release. So that's what it actually lifts your pelvic floor, and then it maintains the tone of your pelvic floor. That's the main reason the hypopressive techniques are used. So what are the recommendations basically? So mild to moderate physical activity such as walking, swimming definitely decreases the risk of urinary incontinence. Focused training of pelvic floor muscle is required. It results in lift of pelvic floor. It decreases, or it creates a smaller levator hiatus area, and it goes for the hypertrophy as well. So you will see the PFM hypertrophy as well. Normally 3 sets of 8 to 12 close maximum PFM contractions are recommended. 3 to 4 times a week for regular strength training, whatever you're doing, okay? But it varies according to your physical activity. It varies according to your sports which you're training for. Correct PFM contraction is very important. Most of the researcher, if you have seen it, or most of the people you have seen it, the people are actually doing an incorrect PFM contraction, which causes more damage to the structure rather than actually treating it. So whenever you're going for a sports training or you're thinking of a high intensity exercise, please learn the proper PFM contraction under the supervision of physiotherapy. Learning the proper technique is very important when you want to move to the high intensity exercise. And the last part and very important part is the health promotion and prevention. People are not aware of this. Many researchers have highlighted this point, that people are not aware that the incontinence actually happens. So health coaches, training of health coaches, personal trainer, fitness trainers is actually recommended, so that the prevalence or the risk of the PFT can be reduced. There are some unanswered questions because this is a very hot topic which is going on now. We don't have specific guidelines for PFT for female athletes. We have very limited research on anal incontinence and pelvic organ prolapse when it comes to high intensity exercise. A lot of research is actually present for the urinary incontinence, but not for the anal and for the pelvic organ prolapse. We don't know what is the static sports and dynamic sports has a effect on the PFM and the PFT as well. And we don't know what is happening in the weight training. As though there is a study happened recently in a power lifters, and they found that the urinary incontinence were more higher in power lifters, but we don't know about the weight trainer area. So certain things are still unanswered. Prevalence is there, but people are not aware that they think that it is normal. So we need to raise the awareness. Thank you very much.
Thank you, Ms. Sonia, for sharing your expert knowledge and providing us with good lot of information. Of course, a topic on women's health is a need of the hour, considering the contribution of women to the society in today's world. And with this, we come to the next part of our session. Dear viewers, if you have any questions for Dr. Steve and Ms. Sonia, please leave a comment, and the speakers would be happy to answer your queries. There's a question from Mr. Rajan Sundra to Dr. Steve. Dr. Steve, any permanent injuries due to overdoing this high intensity exercise? Also, any precautions to be taken for those over 50 years old?
A very good question. And as one who is well over 50 years of age, there's nothing wrong with high intensity exercise for us young people over 50. No, it's from a physiological perspective, it's not a problem provided you build up to it. You don't want to chuck in the deep end. So, and of course, you need to get medically screened before you would start a high intensity exercise program if you're starting from scratch. As far as overdoing these high intensity exercises, there are two aspects from that. One is from a musculoskeletal perspective, and obviously there's risk associated with, particularly with aging, with the degenerative change, that you don't want to be doing high impact exercises necessarily, with the risk associated with it. From a cardiovascular perspective, it's no great risk associated. You can do overtraining, you can overtrain, and that's not uncommon in athletics. And your signs of overtraining are things such as your morning heart rate. So if you're an athlete, you look at monitoring early morning heart rate. So when you wake up, and what you'll find if someone's overtraining is that their morning heart rate's actually higher, and that's an indication that they're overdoing the training. That's male or female, as well as they'll have increased blood pressure. So from a risk perspective, permanent injuries, normal sort of from a physiological, no, provided they've been medically screened, and from a musculoskeletal, ease into it gently. It's probably the advice I would give for anyone starting a high intensity exercise program. Hopefully that answers the question.
Thank you, Dr. Steve. The next question is for Ms. Sonia from Mr. Rajan. Is there any effect of these exercises on back pain during these high intensity exercises?
Thank you, Mr. Rajan. Yes, if you're going for a high intensity exercise, and if you're not, your body is not that fit enough, and then definitely if your pelvic floor muscles are affected, then you will end up having the back pain as well. So it does affect. So that's why you don't need to start straight away with the high intensity if you have not done it earlier. So you need to start with the moderate and then go on to the high, so that you're able to actually stabilize. I mean, your core strength is good, your trunk stabilization is good, your posture is good before you actually start. And then you have learned how to control your pelvic floor, especially in terms of resisting the intra-abdominal pressure, so that there is no pressure onto the back muscles. Otherwise, your back muscles definitely will get affected, and then you will end up having pain.
Thank you, Ms. Sonia. The next question is for Dr. Steve from Ms. Neelam. Dr. Steve, is there any early symptoms of over-exercising? Dr. Steve, you need to...
Yep. Okay, sorry. I think from two aspects. One would be from an overall overtraining, in which case, as I said, usually from a physiological perspective, from a cardiometabolic perspective, you would monitor morning heart rates. If you're waking up with a high heart rate in the morning and an overall increase in blood pressure, then you're overtraining from a cardiometabolic perspective. And that's a common sign in athletes who are overdoing it. You can also have from a musculoskeletal perspective, which is if you're still sore 2 days after you've done the exercise, I think you've overtrained. So, it should be the first few times it may be sore for a day or two, but if it lasts longer than that, I think you need to back off and increase your load gently. So that would be an early symptom of over-exercising in the short term. But overall, like I said, from a physiological perspective, our measures for cardiometabolic over-exercising is that morning heart rate and blood pressure.
Thank you, Dr. Steve. We have the next question for Madam Sonia. What are the treatments available for stress urinary incontinence?
Okay, thank you, Ms. Bavitra, for the question. So we have the main reason for stress incontinence is because your sphincter muscles are not working properly, or the sphincter control is losing, okay, so or it's lost basically. So we need to do a pelvic floor muscle training, okay. Apart from that, you can actually go for the core stability exercise and core strengthening exercises, as we talked about, that the synergist muscles, of synergy between the pelvic floor muscles and the abdominal muscles is important. So we need to work together and we need to have a co-contraction of that. So that's very important. Apart from that, you can actually train your muscles or increase the strength with the vaginal cones or vaginal weights basically. And we can also recommend is the pessary control if the incontinence is too much, especially with the prolapse. So you can go for the pessary control as well.
Thank you, Madam Sonia. The next question is for Dr. Steve from Raja Fatiha. Hello, good day, Dr. Steve. Is there any restriction to exercise for women who are on menstruation?
Good question. Thank you for that. I'll unmute myself. Yes, it's in a word, no. So what the evidence has shown, particularly with high-level athletes, is that there really isn't a change in performance during the menstrual cycle. There is a slight decrease in the premenstrual period. There's some indication that performance is reduced. VO2 max and our energy measures for that don't change over the menstrual cycle. So generally the studies which have shown a change are generally like self-report, and women are saying in the premenstrual period that they don't feel up to exercise, if you like. So it's more an effective response, but VO2 max doesn't seem to change over. So really, from my side, there shouldn't be too many restrictions to exercise for women in the menstrual cycle, any point on the menstrual cycle. It just may be premenstrual. They don't feel like doing the exercises, which can't blame them. So,
thank you, Dr. Steve. We have next question to Ms. Sonia from Mr. Rajan Sundra. Is there any effect of these muscles on back pain during this high intensity exercise?
I think this question has already been answered.
Yeah. Oh, yeah.
Yeah. Sorry.
Okay, so we have another question from Ms. Azika Kamal. Hi, is there any specific exercise we can do to reduce menstrual cramp?
That's Steve?
Not that I'm aware of. I must admit, I'm not. I don't know anything in that area, so I'd have to say I'd pass on that question and handball it to Sonia. Miss Sonia. So
thank you, Dr. Steve. There are few actually yoga poses which has been recommended, like a child pose, which has been recommended to reduce the menstrual cramp, because this is basically menstrual cramp is you just have to understand that it is not your skeletal muscle which is getting contracted, your uterus, which is a smooth muscle which is gonna contract, and these contractions are causing the pain actually, and which is initiating your skeletal muscle contraction. So abdominal cramps or menstrual cramps are basically, reason being is that the uterus is contracting. So you can go for certain position like child pose and some yoga poses which has been recommended, but whether it is actually clinically meaningful, whether actually it reduces or not, there is no data available. It is all very subjective. So not specific, any specific exercises are there which can actually reduce your menstrual cramp. So I mean, the pain is going to be happening, so we just have to bear it.
Thank you, Ms. Sonia. We have another question from Poon Jia In. Is there any side effect of PFM when high intensity exercise is performed during menstrual period?
Not that I am aware of that, whether the high intensity exercise during the menstrual period will have any effect on the pelvic floor muscle. I have not come across any research which answers that question. But in terms of if we are talking about, because when we talk about the menstrual period, we are talking about in terms of nulliparous women and parous women. So when we look at that data and we try to understand this part. So if it's a nulliparous woman, I don't think so there should be any problem. They should be able to do the high intensity exercise, but but you will also have the cramps, you will also have your the physiological tiredness and fatigue, which is normally happens during the menstrual period. So you're gonna end up having that. So high intensity, you will not be able to perform if you're performing for like 20 minutes, you might not be able to perform to 20 minutes. You might be able to do for 5 or 10 minutes, and you might get tired because of that. But if it talks about parous women, or we're talking about a woman who is going for a menopause, then definitely that the PFM would have got stretched because they would have delivered, or the menopausal effects or hormonal effects are there. So that would have any effect on the muscle, basically in terms of your elasticity would be loose and all, and that will definitely increases the risk of your pelvic floor dysfunctions. But it's not going to happen only at the menstrual time, but over the period of time, definitely it will lead to your risk of dysfunctions.
Thank you, Ms. Sonia. We have another question from Nicholas Gann. Is there any studies done on HIIT on hormonal imbalance individuals?
Not that I'm aware of.
No, I am also not aware of any.
I think Mr. Nicholas has to elaborate on HIIT. Right.
Maybe so Nicholas can do that. Yeah.
Yeah. We have had good lot of questions for today, which shows that indeed this topic is the need of the hour, considering the importance of women's health. So with this, we come to the end of today's session. Thank you, Dr. Steve and Ms. Sonia, for joining us today and providing such insightful information. Pleasure. To a wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by MAHSA University. In case of any further queries, you can contact us through MAHSA website or visit us through our social media. Thank you once again and have a pleasant weekend.
Cheers. Bye.